Hey everybody, today's topic is fentanyl. And more or less how it relates to buprenorphine treatment or Suboxone therapy for opioid use disorder. So fentanyl it's a real problem. Fentanyl is very potent, and so when people are using fentanyl, I'm sure that many of you heard that sometimes people need multiple doses of Narcan nasal spray to get out of it because it's so potent and it's fairly long acting. And so, in the same way, when people are using fentanyl, their dose for Suboxone, when they get started on Suboxone, can be quite high. And so that's one factor to consider is when you're transitioning people over is what to expect that their maintenance dose is going to be. It's going to be pretty high, very likely. The second thing is it's hard to switch over from fentanyl over to buprenorphine or Suboxone right away, because even though for whatever reason people think of fentanyl as short acting, it's soluble into a large portion of your body, so your body kind of stores a lot of it, and so it can take 5 days or so to actually get the fentanyl out of your body. So one option is to switch over to something that's short acting. Start using oxycodone or morphine or heroin or whatever, some other short acting opioid, so that you can get that fentanyl out of your system, so you can start on Suboxone without having withdrawal. Now, the other thing you can do is what's called microdosing, and I have another video on microdosing, but you start out with a very small dose, something like half of a milligram a day, which is a quarter of a 2 milligram tablet of Suboxone, and then you gradually double that dose every 48 hours. So 2 days at half a milligram, then 2 days at 1 milligram, then 2 days at 2 milligrams, and 2 days at 4 milligrams, and so on and so on. And after 10 days or so, 10 or 11 days, you should be up to 16 milligrams or more, where you could stop using fentanyl. The key to this approach is that you still use as little fentanyl as you can without having withdrawal symptoms, but you're still using daily fentanyl this whole time. And then once you're up to 16 milligrams or more of buprenorphine, then you stop using your fentanyl, and you've just kind of very slowly transitioned your body from fentanyl over to buprenorphine. Sometimes people are using buprenorphine and Suboxone at the same. If they're using fentanyl and buprenorphine, or otherwise known as Suboxone, at the same time. And I've had situations where, when people are using low maintenance doses of buprenorphine, that when they stop using fentanyl, obviously the buprenorphine is not enough because the fentanyl is so potent. So we have to kind of boost their Suboxone way up. So that, that's another, unusual circumstance where people are using buprenorphine and fentanyl at the same time. So there's just a few facets of that. I've had a lot of conversations with new patients or old patients or whatever about I'm on fentanyl. Every time I start using Suboxone again, I start to have precipitated withdrawal symptoms. I feel sick. I feel trapped, and it's difficult. It's difficult to transition over. A lot of times when people finally contact me and they're like, I need to start with Suboxone, they've hit rock bottom already. They have no money, they can't buy any more fentanyl, whatever. And I'm like, I don't know what to say. You either find something that can, last you for 4 or 5 days so the fentanyl can get out of your system, or you, find 10 days worth of fentanyl, or you're screwed. Because if you start a full dose of Suboxone while there's still fentanyl getting out of your system for the first 5 days, you're going to feel sick as shit. And so, it's sometimes people really have a difficult time making that transition. And so then a few days later, the moment of clarity and motivation has passed, and they start using fentanyl again, because, usually all I need is 12 or 15 hours to switch somebody over from heroin or oxys or morphine or whatever over to buprenorphine, and this prolonged switch can be really difficult for people sometimes. although it might just be that they're just not that motivated to stop at that time. It's just so many factors, it's difficult to say. But, you know, the fentanyl factor does complicate the transition onto Suboxone for some people, but we can usually find a way. So just FYI. But anyway, that's kind of my quick introduction to transitioning to fentanyl and kind of how fentanyl can be problematic. Thanks so much.